Sean and Sue on a Friday, and joining us is Dr. Gerry Chiricolo, MD and Chair, Department of Emergency Medicine, Community Medical Center, and Director, Emergency Ultrasound, RWJBarnabas Health, Emergency Medicine Health Services. Dr. Chiricolo, thanks for joining us today. And let's begin by, give us a little idea about yourself, Doctor.
Well, it's a pleasure, Sean, and thank you so much for having me. And, being a New Jersey born and raised young man who was lucky enough to practice and learn emergency medicine and practice my whole career in New York City, being able to come down to the Jersey Shore where I've spent my childhood and have tons of family and friends who were born and raised down here, to be able to come and work in the community that I love and where I was raised was really an honor for me.
Well, it's great to have you here, Dr. Chiricolo. And summer is officially here, and a lot of us are making a lot of plans to make the most of it. Do you have any tips, though, for folks who are going to be out having fun in that sun?
Oh, well, of course. And I think, the Jersey Shore is all about the sun and the summer and all of the fun we could have. People look forward to this time of year, and it's really prime time for us down here in the Toms River area with the sun. And with that comes a lot of fun and a lot of smiles. But there's also a lot of concerns when you talk about the sun and heat-related illnesses, such as something as simple as a mild sunburn, all the way through to heat stroke. Right, the heat-related illnesses like heat cramps, heat exhaustion, heat stroke, dehydration are all real concerns, especially for all of us, but especially for our older adults, young children, people whose occupations bring them outside a lot, landscapers, people who work on the beach or near the beach. It's definitely something to keep in mind.
Doctor, how do we avoid heat-related illnesses?
Well, there's the obvious answer is to try to limit your exposure to the sun. But like I said, a lot of fun happens on the beach and outdoors and by the pool. So one of the key things we can do is to stay hydrated, maintain your hydration status. And we can't wait until we're thirsty, right? That's the body's mechanism to say we're dehydrated. We need to take some fluids. So the best thing to do is to stay ahead of the game and not wait until you're thirsty. Overhydrate. Drink a lot of water. This is obviously taken into account if you don't have any medical issues like congestive heart failure, where you really want to limit your water intake. That's a more delicate balance and a talk for another time. But for most healthy adults, staying overhydrated and preventing dehydration is key. Electrolyte drinks are great, so you could replenish a lot of the sodium and potassium that you might be losing in the dehydration. But you want to really avoid anything that's a diuretic or anything that's going to, kind of mobilize fluids out your body, such as alcohol or caffeinated beverages. Limiting them is really important. In terms of sunburn or skin-related cancers that develop from excessive sun exposure, wearing sunscreen is critical, and remembering to reapply. Can't just put it on early in the morning and think you're covered for the rest of the day, especially if you have many hours of sun coverage or water exposure. You have to reapply very frequently throughout the day. Any part of your skin that's going to be exposed to sun should be covered in sunscreen while the sun is shining. You could also take cool baths, take a quick dip in a cool pool. The cold water cools your body way more than air conditioning or any kind of fan would, and the two together are even better. You want to wear loose clothes, stay really comfortable, avoid eating hot and heavy meals, and you want to stay in air-conditioned, shaded areas as much as possible. So if you don't have access to that, then you really want to find some public facilities or a cooling center to cool down and keep yourself safe.
How about for the swimmers, Doctor? A lot of folks going to jump in the water. How about some advice for swimmers out there?
Yeah, that's a big one, right? Because according to the CDC, we have about 4,000 fatal drownings a year, 8,000 non-fatal near drownings per year. that's a big number, right? And particularly we should worry about kids near pools because they're kind of quiet and they like to run around and have fun in pools, as they should. But being unsupervised, that's an added risk. So, what I would say is definitely don't swim alone. Have somebody who has some eyes and keep an eye on each other to make sure that everything is safe, especially in the ocean where you have riptides and waves. You want to wear a life vest if you are fortunate enough to be able to go out in a boat, go fishing, or if you're going to be near the water and you're an inexperienced swimmer, you should have some life vests on. Do not drink alcohol or be altered while you're in body of water. And while you're at the beach, make sure that you're swimming in areas where lifeguards can see you. Keep an eye on you and make sure that you're not caught in a riptide or surprised by a rogue wave. Like I mentioned earlier, definitely keep an eye on the children. They're really at risk. Make sure you have fencing in your backyard. It could decrease a child's risk of drowning by over 80% by having a fenced-in pool area. And enroll in swimming classes. Learn to swim.
Doctor, as we wrap up, you've given us some great advice about, being safe this summer, and that's going to help out a lot of people.
Well, I appreciate the time for sure, and I just want everybody to know that I do not want you to need emergency services, but if you do find the need for emergency care here at the Hirair and Anna Hovnanian Emergency Pavilion at Community Medical Center, we're here for all of your needs. We just finished a really large multi-year renovation of the emergency department with individual beds. Patient care, patient-centered care is really at the forefront. Our culture is to try to take care of our community efficiently, quickly, and to the best of our ability with utmost medical accuracy. We're bringing in new technology, bedside ultrasound, where we're performing ultrasounds at the bedside, at the point of care, to try to give us answers to an emergent question quickly. And when our patients come to the ED, they get access to the care even outside of the ED. That we can refer and get our patients to our excellent specialists and general physicians for ongoing care after their emergency needs have been stabilized. So we are committed to our community. We're committed to providing great care, and we really want the community to know that we're here 24/7 for anything they need.
There you go. There to keep you safe this summer at Community Medical Center. Dr. Gerry Chiricolo, thanks for taking time with us today.
Appreciate it, Sean. Looking forward to speaking with you in the future.
To learn more about Community Medical Center, visit rwjbh.org/community.